In this video, we discuss the benefits of using various off-label medications in conjunction during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. The power of the off-label medications that we've described in previous videos is truly in their synergies. Let's take a look at one pairing, metformin and dichloroacetate, DCA. A negative about metformin is that it increases lactate, which can impair treatment outcomes. Lactate not only prevents therapies from reaching tumors, but it also can be used as a fuel for growth for surrounding cancer cells. DCA inhibits lactate, yet DCA has its own problems. It activates MCL1, which is an anti-apoptotic mitochondrial protein. MCL1, BCL2, and BCLXL are the proteins that are upregulated in many cancers and promote cancer immune escape. MCL1 is also essential for the survival of Treg cells, inhibitory white blood cells that hinder the efficacy of many treatments. Metformin downregulates the activity of MCL1. Additionally, DCA can upregulate protective autophagy. In this case, autophagy would promote cancer because it is protecting cancer's genome stability. Metformin inhibits autophagy. This chart illustrates the results of the synergy between metformin and DCA. As you can see, the DCA and metformin inhibit tumor growth nearly equally, but the combination produces virtually no growth from the first day. Let's take this idea further. If MCL1, BCL2, and BCLXL frequently aid tumor escape, could we not add curcumin to the mix, which has been shown to reduce BCL2 and BCLXL and has virtually no toxicities? Another dramatic success in the off-label drug cocktail concept is the CUSP 9v3 protocol for glioblastoma, GBM. The typical survival for a GBM patient is about a year, and only 9% are alive after 2 years. With recurrent glioblastoma, meaning a surgery has been performed and the cancer has come back, the life expectancy is about half a year. Optune, the first-line tumor-treating fields device approved for GBM, is fortunately increasing survival times. The 10-person CUSP 9v3 clinical trial accepted people with recurrent glioblastoma. The protocol consisted of 9 off-label medications: aprepitant, auranofin, celecoxib, captopril, disulfiram, itraconazole, minocycline, ritonavir, and sertraline, in addition to temozolomide, the standard of care medication for glioblastoma. Drugs were added in low doses every 2 days. Once every drug had been added, it had its dosage increased in the same manner that it had been added. There were few serious side effects. No patient needed to be taken off of the trial due to side effects. Dosages of medications were simply modified to reduce side effects. After 30 months, 50% were still alive, and 3 had no measurable tumors in their brain, a resounding success. Another trial testing the cocktail concept with 17 recurrent GBM patients found that propranolol, aliskiren, cilazapril, celecoxib, curcumin with piperine, aspirin, and metformin led to an overall survival of 19.9 months, 36% longer than the 14.6 months predicted with the standard of care. This cocktail was not in addition to the standard of care GBM drug temozolomide, but instead of it. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.